Hypersomnolence disorder represents one of the most misunderstood and debilitating sleep-wake disorders affecting millions of individuals worldwide. This neurological condition, characterized by excessive daytime sleepiness despite adequate nighttime sleep, profoundly impacts every aspect of a person's life, from professional responsibilities to personal relationships. Unlike the occasional tiredness experienced by most people, hypersomnolence disorder creates an overwhelming and persistent need for sleep that cannot be satisfied through normal rest patterns or brief naps. The hallmark symptom of hypersomnolence disorder is excessive daytime sleepiness that persists for at least 3 months, occurring despite receiving 7 or more hours of sleep nightly. Individuals with this condition often struggle to maintain alertness during routine activities, finding themselves falling asleep during conversations, while eating, or even during potentially dangerous situations such as driving. The sleepiness is not merely feeling tired. It represents an irresistible urge to sleep that can strike without warning, making it impossible to function normally in daily life. Sleep inertia, another defining characteristic of hypersomnolence disorder, manifests as extreme difficulty awakening from sleep, regardless of sleep duration. People with this condition may sleep for 10, 12, or even 16 hours and still wake up feeling completely unrefreshed and disoriented. This prolonged confusion upon awakening, known as sleep drunkenness, can last for hours, during which individuals may appear intoxicated, display poor coordination, exhibit slowed thinking, and demonstrate impaired judgment. Family members often describe having to use extreme measures to wake their loved ones, including multiple alarms, physical shaking, or even cold water. The cognitive impact of hypersomnolence disorder extends far beyond simple sleepiness. Concentration becomes severely compromised, making it nearly impossible to focus on tasks for extended periods. Memory problems plague sufferers, affecting both short-term recall and the ability to form new memories. Processing information becomes laborious, and decision-making skills deteriorate significantly. These cognitive impairments often lead to poor academic or work performance, creating a cascade of secondary problems including job loss, academic failure, and diminished self-esteem. Diagnosing hypersomnolence disorder requires comprehensive evaluation by sleep medicine specialists. The diagnostic process typically begins with detailed sleep history questionnaires and sleep diaries documenting sleep patterns over several weeks. The Epworth Sleepiness Scale helps quantify the degree of daytime sleepiness experienced in various situations. Polysomnography, an overnight sleep study, rules out other sleep disorders such as sleep apnea or periodic limb movement disorder that might cause secondary hypersomnia. The Multiple Sleep Latency Test, MSLT, measures how quickly someone falls asleep during scheduled nap opportunities throughout the day, providing objective evidence of pathological sleepiness. The underlying pathophysiology of hypersomnolence disorder remains partially understood, though research suggests dysfunction in brain regions responsible for sleep-wake regulation. The hypothalamus, which contains the body's master circadian clock, may not properly coordinate arousal systems. Neurotransmitter imbalances, particularly involving histamine, dopamine, and orexin/hypocretin systems, likely contribute to the persistent sleepiness. Some cases appear to have genetic components, with family clustering suggesting hereditary factors. Brain injuries, infections, or autoimmune conditions can also trigger hypersomnolence disorder, indicating multiple potential pathways to developing this condition. Treatment approaches for hypersomnolence disorder are multifaceted, requiring careful coordination between patients and healthcare providers. Stimulant medications such as modafinil, armodafinil, methylphenidate, or amphetamines form the cornerstone of pharmacological treatment. These medications work by enhancing wakefulness-promoting neurotransmitter systems in the brain. However, finding the right medication and dosage often requires extensive trial periods, as individual responses vary significantly. Some patients may need combination therapy using multiple wake-promoting agents to achieve adequate symptom control. Beyond medication, behavioral interventions play crucial roles in managing hypersomnolence disorder. Strict sleep hygiene practices help optimize nighttime sleep quality, including maintaining consistent bedtimes, creating optimal sleep environments, and avoiding caffeine or alcohol. Strategic napping schedules may provide temporary relief, though timing must be carefully planned to avoid interfering with nighttime sleep. Light therapy using bright light boxes can help regulate circadian rhythms, particularly when combined with consistent wake times. The social and emotional toll of hypersomnolence disorder cannot be overstated. Relationships suffer as friends and family members struggle to understand the constant need for sleep, often misinterpreting symptoms as laziness or lack of motivation. Social isolation becomes common as individuals withdraw from activities they can no longer enjoy or participate in safely. Depression and anxiety frequently develop as secondary conditions, creating additional challenges that require comprehensive mental health support. Educational and occupational accommodations become essential for individuals with hypersomnolence disorder. Students may require extended time for assignments, flexible scheduling, or permission to take strategic naps between classes. Workplace modifications might include adjusted start times, frequent breaks, or alternative work arrangements that accommodate unpredictable sleep episodes. Legal protections under disability laws can provide important safeguards against discrimination, though many people with hypersomnolence disorder face ongoing challenges in obtaining appropriate accommodations. Research into hypersomnolence disorder continues advancing our understanding of this complex condition. Scientists are investigating new therapeutic targets, including novel wake-promoting compounds and approaches to modulating circadian rhythm dysfunction. Genetic studies are identifying potential hereditary factors that might lead to personalized treatment approaches. Advanced neuroimaging techniques are revealing brain structure and function differences that could inform future diagnostic and treatment strategies. Living with hypersomnolence disorder requires developing comprehensive coping strategies and building strong support networks. Patient advocacy organizations provide valuable resources, connecting individuals with similar experiences and offering educational materials for family members and healthcare providers. Support groups, both in person and online, create communities where people can share experiences, treatment strategies, and emotional support without judgment or misunderstanding. The prognosis for hypersomnolence disorder varies considerably among individuals. Some people achieve good symptom control with appropriate treatment combinations, allowing them to maintain relatively normal lives with some accommodations. Others continue struggling with persistent symptoms despite optimal treatment, requiring ongoing adjustments and adaptations. Early diagnosis and treatment generally improve outcomes, emphasizing the importance of recognizing symptoms and seeking specialized care promptly. Future directions in hypersomnolence disorder research hold promise for improved treatments and potentially even preventive strategies. As our understanding of sleep-wake neurobiology advances, more targeted and effective interventions may emerge. Personalized medicine approaches could optimize treatment selection based on individual genetic and physiological profiles. Increased awareness among healthcare providers and the general public will hopefully reduce diagnostic delays and improve support for those living with this challenging condition. Hypersomnolence disorder represents a serious medical condition that profoundly impacts quality of life, demanding comprehensive medical care, understanding communities, and ongoing research efforts to improve outcomes for affected individuals.